Herpes, genital herpes, it's a sexually transmitted infection that lots of people are worried about. This video is just going to talk about some points that would help you understand it a bit more. Herpes, which is herpes simplex virus, it's a sexually transmitted infection. You can have type 1 or type 2, which tells you what kind of strain of herpes you have. It's super common, but unfortunately there's a whole lot of stigma surrounding herpes that would make any patient worry. It's quite important, if you feel your symptoms are herpes, you need to come in and get tested so you can be advised adequately, and you will be provided with the right treatment, which is in the form of an antiviral medications, and we'll just advise you on general ongoing care. Herpes can affect both male and female. Unfortunately, even if you use condoms all your life, it's something that you can still have because it's through skin-to-skin contact. It's something that unfortunately stays with you forever, but you can manage how frequent you have outbreaks through either long-term treatment, or it's just all about how you look after your immune system. Condoms are good, but it doesn't cover the whole genital region, and that's how it can be transmitted. So if you are presenting with a sore or spots that you think is herpes, it's not necessarily that you acquired it from your current partner. You could have acquired it from years ago, but it's just now perhaps your immune system's been depleted, that they just woke up and they appear. Also possible that if your current partner has active lesions, of course, transmission is from that person. It can affect any age. There's a whole lot of unnecessary stigma that's associated with herpes. It's just one of the, viruses like chickenpox. Nobody stigmatizes you if you've got chickenpox. It's all in the same sort of category. It's easily managed. It's something that stays with you forever. It's not written on your forehead, so you should stop just being so self-conscious that I've got herpes, everybody knows. It definitely shouldn't take over your life. You can live your life as normal, just certain measures would need to be taken into effect if you've got an outbreak, so you don't unintentionally infect other contacts that you may have. So herpes, if you've got an outbreak, a swab can be taken on the sore that you have, which would tell you whether you've got type 1 or type 2. Type 1 is predominantly, orally, but nowadays, because of oral sex happening, a person could be infected with type 1 in the genitals. But doing a swab would definitely be helpful because it will give you more information which strain of herpes you have. So having type 1 doesn't make you immune to having type 2. Likewise, having type 2 doesn't make you immune to having, type 1. So if you've ever seen somebody with a spot or a sore on the lips, that person has herpes, but, a society just consider it as, oh, I've got a cold sore, but that is herpes, it's type 1. So another way you can test for herpes is by doing a blood test. The blood test as well will tell you whether you've got type 1 or type 2. Sensitivity is more with a swab. The blood test, however, can be quite helpful. When you're attending to have a blood test, it has a look-back period of 17 weeks from when you think you've been infected. But if you've got an active sore or spot or a lesion, then a swab would be more appropriate. But when you come in, we'll decide on which of the two tests is the best one.